Possibly we need to be more aware as a group of people to understand what Alzheimer is, what the patient might be going through, and be a little sensitive to that. So, let's say be. Good afternoon, doctor.
Good afternoon.
India is a very big country, lot of people, lot of issues, lot of diseases. We feel that neurological disorders are less understood, and today we are here to hear some inputs from you, because we feel that more people know about diseases, the better they can take care of themselves. So, sir, out of all the neurological disorders, how common is Alzheimer's?
Good afternoon, and thanks for giving me this opportunity. Regarding the incidence of Alzheimer's disease amongst various neurological disorders, it varies from place to place, depends on whether it's urban setting or a rural setting, whether data has been collected from a tertiary care hospital or a primary center in the village. But we do know is that it's the commonest cause of dementia. So much so that almost 70 to 80% of the patients with dementia have Alzheimer's disease. And Alzheimer's is gradually increasing in incidence because it's a disease of elderly. And as the aging population is increasing, the incidence of Alzheimer's is also increasing.
Thank you, sir. So, what exactly is Alzheimer's? What happens in that? I mean, is there something, there's some symptoms, some highlights which common people can identify?
So, Alzheimer's is a neurodegenerative disorder. Degenerative means there is a gradual degeneration of the brain cells, and it has been found it's generally due to deposition of a protein called amyloid beta, along with some neurofibrillary tangles and plaques, which are deposited in certain areas of brain which control memory. The reason for it is not well known. There may be some genetic component, but predominantly it's related to.
It's okay. Continue.
Is there may be some genetic component, but predominantly it's not a genetic disorder. It's related to environmental factors, your education, certain vascular factors like diabetes, blood pressure, but still we really do not know what causes Alzheimer's disease.
So, sir, in India, what would you say? I mean, what is the incidence of Alzheimer?
We know recently there was a study conducted in 2013, and as per the data available, we presume that there are about 50 lakh people suffering from dementia, and out of that 70 to 80% is due to Alzheimer's disease. And we also know that the incidence is gradually increasing, it's likely to double by 2030.
Sir, there are certain affiliations or correlations between age group. You mentioned that this is a disease for the seniors. Is there a correlation with the type of occupation, the cross section of society? Is there any correlation with the disease and the type of occupation or the kind of cross section of society the person comes from?
Alzheimer's or dementia is more commonly seen in people who have certain vascular risk factors like diabetes, blood pressure, cholesterol, sedentary lifestyle, smoking. And there are certain protective factors like education. People who have higher education, who regularly indulge in some mental activities, have less chances of developing Alzheimer's disease. What was the second question?
The second question was primarily cross section of society.
So,
linking people.
The biggest risk factor remains age. So much so that above the age of 65 years, almost 10% of the people have Alzheimer's, while if you reach the age of 85, 90, almost 40% of the people have Alzheimer's disease. So we have many factors, but the age remains the most important factor.
Thank you for guiding us on that, sir. So, what is the easiest method of identifying if a person has Alzheimer's or not?
Alzheimer's remains a clinical diagnosis. There are no tests to confirm Alzheimer's. The only confirmation is by autopsy when you open up the brain and look it under the microscope. However, there are clinical indicators. Person presents with memory impairment, forgetfulness, not able to think clearly, not recognize people, relatives, unable to find his way about. So, whenever these features are there, which suggest some degree of cognitive impairment, some loss of executive function, and there may be some behavioral change like depression or aggression. So, these things suggest that the patient may be having Alzheimer's. Then we have certain neuropsychological tests by which we determine whether it's likely to be Alzheimer's or some other form of dementia. However, we should not miss the treatable causes of dementia, and it's very important to carry out certain tests so that the treatable forms are identified and treated separately and not clubbed with the Alzheimer's disease. And if we want to highlight the common treatable causes, well, there are certain deficiency disorders like B12 deficiency, hypothyroidism, low serum sodium, people who have lung disease, if they have high carbon dioxide in the blood, that can also impair cognition. Certain brain diseases like brain tumor or excess water in the brain. So there are many things which we need to exclude before we say that the patient has non-reversible reasons for dementia.
Sir, you mentioned the word degenerative, and then again you mentioned non-reversible. Can you highlight a little bit more on this?
So degenerative process, as of now, we may be wiser in future, but degenerative process as of now means that it's due to neuronal degeneration for which mostly there is no cause, and it's an irreversible process. It's likely to worsen over a period of time, and we may be able to slow down the rate of progression but not halt the process, not reverse the process.
So, what kind of advancement in identification and treatment is happening in India? I mean, is there a change in the technology we're using, the kind of treatment we are using, the kind of detection that we are doing in terms of what was happening in the yesteryears and what is happening now?
So the awareness is much more now. As I said, there is no diagnostic test for Alzheimer's. However, since there is awareness about other causes of dementia, more and more people are getting worked up for this with blood test, EEG, MRI, and wherever indicated, even a blood lumbar puncture or CSF examination. Again, all this is to look for reversible causes. Now that MRI is available widely, many people who come with dementia are getting MRI done, and workup is a routine for all patients.
So, a very sensitive question to ask, and this is again for our audience. What kind of indicative costs people incur if they identify somebody as Alzheimer and they would really like to take care of the patient? What is the kind of cost?
So, the cost can be a direct cost or indirect cost. Direct cost is the cost you incur on managing the patient, like with investigations, drugs, regular hospital visits. However, more important is the indirect cost, because in Alzheimer's, the patient is suffering, but the caregivers are also suffering. They have to look after the patient. After a while, as the disease progresses, the patient may not be able to look after himself, need support all the time, may wander about. I know people who keep their houses locked so that the patient may not go out and may not be found. So the indirect cost keeps rising, especially caregivers. They have to take time out of their daily routine to look after the patient. They may not be able to attend their offices, do their routine work, and if many people employ help, which is also indirect cost. And if the patient is reaches a stage where we cannot manage him at home, then the patient may have to be institutionalized, which is again a big cost. So there is direct and indirect cost of managing a patient with Alzheimer's disease.
So primarily what you said, that the indirect cost, which is possibly at this point in time not measurable to that extent, the incidence of that is much more than the direct cost.
So in India, most of the patients are looked after by their family members. They are looked after at home. And we don't have too many facilities for looking after these patients. We don't have nursing homes. We don't have institutions. So the cost for the family is much more than we can envisage. However, it is thought that probably annual cost of managing patients with Alzheimer's in India would be to the tune of 15,000 crores. This.
So, interestingly, you said degenerative, which is a little scary because we do not know how to prevent it, stop it, or absolutely reverse it. But you also said that it can be delayed. I mean, I think till our technology, medicine goes to that extent that we can absolutely halt it, maybe this sense of delay is going to give us a lot of respite. So, could you highlight on how we can delay it?
So, we have certain medicines. One of the chemicals in brain, acetylcholine, is thought to play a role in Alzheimer's disease. And I mean the deficiency of acetylcholine or less of acetylcholine. So we have drugs which can increase the level of acetylcholine, which are called cholinesterase inhibitors, and they remain the first line drugs. Like I can take the name donepezil, rivastigmine, and then there is another drug which acts at a little different level, mementin, that acts on glutamate. It's a glutamate inhibitor. So we have these drugs, and besides drugs for Alzheimer's, these patients have behavioral problem. So we need to manage their depression, their psychosis, their aggression. So we have drugs for that as well.
So these drugs primarily prevent the formation of the toxins at the neuron ends?
No, these drugs are primarily to increase the neurotransmitters in brain or block a certain bad neurotransmitter. They do not do anything to the primary disease process. We don't have drugs as yet.
So, what you mentioned as medicines are would be administered once a person is identified clinically with Alzheimer's or dementia. What I'm trying to understand is there something people can do to prevent this whole process of Alzheimer's setting in? Some lifestyle change, some exercises.
So as I said earlier, one of the causes or risk factors is vascular disease, and all the vascular risk factors like diabetes, blood pressure, smoking, cholesterol, if we manage these, then the chances of developing Alzheimer's decreases. In addition, leading a healthy lifestyle, eating healthy, there are couple of things which have been found to be useful, especially in India, turmeric, and in the West, a Mediterranean diet, which have been found to have some role in Alzheimer's disease, or the prevention of Alzheimer's disease, delaying the onset of Alzheimer's disease. So these are the various things which can be done. Of course, stop smoking, that's a big risk factor. Indulge in certain mental activities like solving puzzles, doing Sudoku, or something like that which keeps your brain little involved and active.
So you interestingly mentioned that education plays a critical role. Obviously, education means somebody is using the brain. We get to hear that people who engages with the brain, you mentioned about puzzle, Sudoku, in India where the basic education level is low. Can you suggest something that normal common people can do to ensure that their brain functions better?
So we now have moved to age of computers. Even 2 plus 2 people are using a calculator. So the more you use your brain in day-to-day activity instead of using aids, the more likely that your brain is active, and probably it will delay the onset of some form of dementia or Alzheimer's.
Right. So, coming back to that cost related interaction that we had, you mentioned that the indirect cost is pretty steep or exorbitant, as we could understand. Here, the role of medical institutions, doctors like you, in terms of educating the family, in terms of educating how to treat the patient, in terms of bringing a sense of belongingness to that patient, is very critical. So, what kind of initiatives are being taken, not by you alone, but by the medical fraternity at large, in terms of educating the family?
So first is to increase awareness about Alzheimer's disease. I mean, before a person is diagnosed with Alzheimer's, how to recognize symptoms which may be suggestive of Alzheimer's. We tend to ignore these symptoms and say that they are due to aging, or they are due to depression, or they are due to circumstances. However, if we are aware of the symptoms, maybe we can diagnose it early. Once it is diagnosed, we have very limited options as far as the therapeutics are concerned, which I mentioned earlier. But more than the medicine, and it's a progressive disorder, despite medicine, the patient is likely to worsen, and generally it is seen that average lifespan after diagnosis is about 6 years. Some people live for 3 years, some people live for 10 years. But average lifespan is 6 years, and towards the end of that lifespan, the patients are totally oblivious of what's going on around them. They are totally dependent, and many of them succumb to chest infection, pneumonia, or dehydration. So we have to tell the family members to look after these aspects. Keep the patient hydrated, avoid injuries, as far as possible bring the patient to medical attention if there is a new development, give the medicines on regular time, and be compassionate, be understanding that the patient is not doing all this deliberately. He or she is not aware of what's going on around. So we have to understand and be compassionate and accept that this is the problem and look after in the best possible manner.
So, last but not the least question. I mean, this was some medical infrastructure related question that came to my mind. I was reading a data that India has around 1100 doctors who have specialized in neural science, and we possibly produce around 80 doctors annually with specialty in this profession, and most of these doctors are naturally settled towards the city. So, as not only a doctor but somebody from the medical community, is something being proposed, is something being thought about in terms of creating more capability among people? I don't think this is in the ambit of paramedics. It requires a high level of education, high level of speciality to treat. So, is there anything happening in that area that you'd like to tell our audience so that they feel a little safe in terms of the distribution of doctors in India?
So, doctors will be where the facilities are. If you go to a village where there is no MRI, no EEG, you cannot evaluate the patient completely, you cannot do what you are trained to do, then you will feel little flustered, and you may start feeling little depressed. Say, what I am doing here with all my knowledge. So infrastructure has to be there before doctors can go to remote areas. At the same time, we should try and educate general practitioners about the common neurological disorders, and also tell them when to refer these patients to cities or higher centers where the facilities are available. Now, as far as I understand, awareness amongst general physician, awareness amongst specialist, and awareness amongst general population. These are the three things which can help, even if the specialists are not there in the village or in the rural area. If we can teach them to recognize the symptoms, to manage common conditions, and refer patients for assessment who need referral, not everyone. So that can help, and I think we should, of course, try and increase the number of neurologists in India. For that, you need centers of education. Without that, you cannot produce neurologists. So number is very little. We at the moment there are only 11-1200 neurologists all over India, and most of them are concentrated in the cities.
Right. Dr. Garg, thank you for highlighting so many things. My last request, would you like to give a 30-second advice to the population at large on how to take care of themselves in terms of neurological disorders? Not necessarily Alzheimer's.
So I would say that don't ignore symptoms. And what we have is, especially for problems which require urgent attention. The best example is stroke, and we have this mnemonym, what do you call the 4-letter FAST. That the moment you see any facial asymmetry, any arm droop, S is for speech and T is for time. So if you have any of these things, rush the patient to hospital. We are losing millions of neurons every second. Similarly, don't ignore symptoms. In India, we have this tendency that probably it will pass off on its own. This morning, I had a patient, a doctor's brother, who had numbness in his hand since last night, and he just thought it will go away on its own, and he had minor stroke. So we tend to ignore symptoms. We have to educate people, we have to educate even doctors that these are the common neurological conditions, these are the common symptoms. You should not ignore symptoms, you should consult an appropriate specialist at the earliest.
Sir, thank you for your time. Thank you. I am sure our audience will benefit from the inputs you give us. Thank you so much.
Thank you very much.